Hello, everyone, and welcome to Black Health Trust. I'm Dr. Ivan Walks. I'm joined today by Dr. Jocelyn Hines. Our founder, Dr. Randall Maxey, is not going to be with us today, and Dr. Nabrit Stevens is also not going to be with us today. So there's all the bad news. The good news is we have Dr. Warren A. Jones with us today. Dr. Jones doesn't know that my introductions tend to be less flowery than other folks because I hit on the important things. Dr. Warren A. Jones is a family practice practitioner extraordinaire. And I'm going to ask him to introduce himself and to let us know a little bit about what we are doing today and why this is such an important topic for us to discuss. So, with no further ado, Dr. Jones, thank you for being here with us. Appreciate it.
Well, thank you very much, Dr. Walk, and thank you to all of the members of Black Health Trust for allowing me to spend today with you. I was just saying how good it is to not be on the road for a change. And excuse me, hopefully we can have fun this afternoon and exchange some information.
Okay.
As was mentioned, I'm a family physician and an adolescent medicine subspecialist. I'm a graduate of an HBCU, Dillard University in New Orleans, and one of the first 10 Black graduates of the Louisiana State University School of Medicine. Uh, um, I, uh, I did a career in the Navy at 28 and a half years, and when I retired, I was the senior medical director for the Worldwide Military Health Program.
Mm.
I also had the honor of serving as the first Black president of the American Academy of Family Physicians, which has over 136,000 members. Um, I also had the honor of being the first Black Associate Vice Chancellor for the University of Mississippi School of Medicine, and still a professor emeritus from there. And last thing I'll share for foundational purposes is that I had the dubious distinction of running the state Medicaid program. I call that the dark summer of my life. And I wanted you to know that because I've had experience at the practice level, at the um, at the civilian level, at the military level, and as the head of the largest primary care specialty group in America. And my probably last opportunity to lead is as the president of the Diabetes Foundation of Mississippi. So thank you for the chance to be here. You know, I don't like talking about myself, but I was once told that if you don't blow your own horn, sometimes there's no music.
There you
So,
go.
so I hope that all of you take the opportunity to blow your horn about what you've had the opportunity to do, especially if it's played a role in helping people to live healthier lives and live longer.
Dr. Jones, we're having a little bit of difficulty. Is that question, is that my internet or is that everyone's internet?
Oh, and I think that might be you because I'm not frozen yet. I saw you freeze up for a moment.
Okay, that's me.
Okay.
Okay, go right ahead.
Yeah. So I'm looking forward to being here. Today, we wanted to talk about, excuse me, the benefits and the need to make sure that we get the appropriate immunizations that we need, the shots and all of the things we need. You know, it's interesting that some people say they want to get a vaccine because the first thing they'll tell you is that, well, I remember what happened with Tuskegee. And Tuskegee was a dark period in the history of America. And for those who may not know, they recruited Black men to follow the course of treating them for bad blood, which is what syphilis was. And they promised them they promised them appropriate health care and medications and gave them a small stipend. But what they didn't tell them was that health care did not include treating them for syphilis. So for decades, they followed them. And many of the men died. Many of the men infected their wives. Many of the men had children who were born with congenital syphilis. It
Yeah.
wasn't until much, much later that it was recognized that the CDC actually participated in that process. by not recognizing the rights and all of individuals. So now there are protections for people who want to get health care, who want to engage in studies, and to want to advance science. And we've got to advance science, particularly as it pertains to Black people, so that we can know what mechanisms work and don't work.
Mhm.
Now, I use that as a premise to tell you about why I wanted to talk to you about being vaccinated and the role it plays in wellness and prevention. Um, uh, as as Dr. Walks and I were talking pre-program, we found out that we each have a little frost on the head and a little in a trail of years behind us. And we remember when the time was that someone would die and cause of death would be natural causes. Well, that's a diagnosis you don't see on death certificates anymore because science has evolved to the point of being able to identify what most people die of when they die. And it's also led us to the research that's helped people to not die from some things that are treatable. That's the segue to vaccination. Just so you'll know, vaccines don't save people's lives. Vaccination saves people's lives.
Mhm.
So you can be around vaccines all day, but if you don't get vaccinated, then you won't. I remember reading about smallpox, and I got that um, big bruise on my arm because I remember the old time we got a vaccine, we got to prick it, and we ended up with a big scar. But it helped to eliminate smallpox in the US.
Mhm.
Okay. And then I remember some kids being um, crippled from polio.
Mhm.
And then the Sabin vaccine came out, and it was initially a shot and then under your tongue, and now it's done in other ways. Each time we find a way to prolong people's lives if they're afflicted, vaccines play a role in that. We don't have to go back to ancient history. We can look at it in the last 5 years when COVID hit. And initially, the death rate was staggering until the development of the vaccines came along. And all of a sudden, people still caught COVID and felt like crap, but they lived.
Mhm.
They lived. And that's the purpose of what I want to talk to us about today, especially for our audience. Most often, we don't have a medical home. Most often, we don't have the opportunity to afford the healthiest meals. Most often, we have difficulty getting in to see our clinicians because the practices that will see us that either have a non-favored type of insurance or reimbursement, or those of us that don't have any. So what we've got to do is we've got to know that if something is offered to us that can help to save our lives, that we have to accept it.
Mhm.
And vaccines can do that. So I wanted to talk to you about flu. You know, a lot of people say, well, it's just the flu. Well, more people die from complications of flu every year than people even imagine. And for over 28 and a half years, I was in the Navy and I got a flu shot every year. Okay. I caught the flu, but I never got sick. Okay. When I got out of the Navy, I didn't take a flu shot because I didn't have to. Dumb me. I caught the flu, got a pneumonia, ended up being hospitalized for 7 days.
Mhm.
So it taught me a lesson that I hope others don't have to experience. Influenza is real. And you guess you want to say, why do you have to get a new flight every year? Because viruses are determined that they're going to survive. And what they do is they mutate. And so every year, the scientists are studying what are the prevailing viruses in the southern hemisphere of the world. And how do we prepare those of us in the northern hemisphere of the world to be able to deal with those? And that's why you get a vaccine every year, because it's based upon the vaccines that showed up in the flu season in the southern part, like South Africa and South America, Argentina, Bolivia, places like that. Okay, so I wanted our listeners to know you're not being you're not being used as a guinea pig. You're actually being given an opportunity to help your body to be tested so that if you are exposed to the vaccine, and say, oh, I've seen this before, and it can wipe it out before it wipes you out. So it's important to think about that. And so I definitely say the influenza vaccine. There's another thing, influenza deaths among people of color is among the highest rates in the world. Why? Because people who are most affected are people with diabetes. People most affected are people with heart disease and high blood pressure. And we lead the world in those statistics as people of color. We lead our nation with those for sure, but we may lead the world. So a lot of people don't know, but getting a flu shot actually protects your heart from having really bad outcomes from exposure with your heart disease. And I've got high blood pressure. Thanks, mom and dad, for making it hereditary for me. You helped me to live a long time, but I know I got to live with it and not die from it. Another vaccine I want to talk to you about is COVID. You know, folks said, well, I had my first and second COVID. Well, folks, COVID is constantly changing as well. So I'd encourage you to get a COVID vaccine and contact your doctor or your pharmacist and make sure you're up to date. You know, may I backtrack for 1 second? The best way to make sure that you're healthy and you live a healthy life is to have a medical home. That place that you go to for care, where the doctor in the office knows you
Mhm.
and knows your family, and it's a place that you trust and they trust you to be a part of the healthcare team. But when you select that care, make sure that it's patient-centered, that you are the most important thing about it, not the time. Make sure it's family-centered, because so that they know that they can work with you and your family. And make sure that it's team-based care, so that if they need to refer you out to someone, it is someone that they have a relationship with, so that the results will come back. I get referred out to a GI doctor. I get referred out to a cardiologist. I get referred out to a pain medicine specialist. I get referred out to a physical therapist, and all of them coordinate with my primary care doc, my family doc, to make sure that this humble Lord that we call Warren is still here. And I'd like for each of you to have that same joy as you go on living your lives healthily each and every day. So think of the flu vaccine. Oh, by the way, go back to your flu vaccine for 1 second. When you're young, you need a certain type of flu vaccine, but when you're older, you need a stronger type of flu vaccine. That's why there's a lower strength for young people, less than 60 to 65, and then a double strength, a stronger verse for those of us 65 and older. So tell your family members that one, they need it, and tell them to be sure to ask their doctor or their pharmacist for the right one. The same thing with COVID. Make sure that you get the most up to date. And the next one I'll talk to you about is herpes zoster shots or shingle shots. Okay. If you've ever had the shingles, it's no fun. Oh my God. It feels like you got 10,000 needles going through your skin all the time. Okay. I had it way back when the earth was cooling. And I said, I hope I never get that again. So when I talked to my doc, I said, I've had it once. They said, but that virus mutates also. So you need to get the new series. So even if you had the shingles in the past, talk to your doctor or your pharmacist about making sure you're up to date. You know, a lot of our young people did not get the vaccine that could help prevent cervical cancer in young women and other kinds of conditions in young men, in older men. And we need to make sure that they get that that vaccine to help to prevent them from getting cervical cancer. It's one of those things that you may not think about, but I add that to the list for my teenagers to tell their parents to always make sure that they get that vaccine as well. My poor daughter, who just graduated college, my youngest, who is going in to get her master's, she said, Dad, I feel like I'm a walking experiment. Everything that comes out, you tell me I have to get it. I said, baby, I do that because not only do I want to add years to your life, but I want to add life to your years so that as you age, you can be the Madison Jones you want to be and not be crippled by things that are preventable.
Mm.
And I want to give you an opportunity to ask me some questions. So the last one I will mention, there's one that a lot of people don't think about, and that is the prevention of pneumonia by
Mm.
getting Prevnar, because getting that pneumonia shot can help to make sure that a cold does not progress to a pneumonia, because a pneumonia will punch your ticket and wipe you out. And I can tell you, I caught a fungal pneumonia back in '94 here in Mississippi. I went to my in-laws farm and I was picking some fresh greens and I got an updraft of a fungus. And 2 months later, I was coughing and I couldn't figure out why. And it had whited out my lungs on radar, on X-ray. Come to find out that there's a fungus called North American blastomycosis.
Mm.
And in trying to treat it, the doctors almost wiped out my liver.
Wow.
Okay. Now, fortunately, there's no vaccine. Unfortunately, there's no vaccine. But I'm saying to you that there are lots of things that are there, but it's going to be just a matter of time before a vaccine is developed for North American blastomycosis. And you know who's going to be in line to get it if God allows me to still be here? I hope you can see my hand. I'm going to get
Yes.
it. So, what I need you to do, folks, is this: talk to your doctors. And if not, go to Google or whatever your search engine is and look up something called the United States Preventive Services Task Force. It is USPSTF. Okay? USPSTF stands for United States Preventive Services Task Force. And why is that important? It not only tells you what your immunizations should be at what ages, but it also lets you know what exams you ought to have at what ages. And that will make your being able to interface with your doctor a great deal more effective and will help you to live a healthier life. So, with that, if you don't mind, I'd love to open up to any questions you may have. You got to excuse me, I'm not the smartest guy, and I'll turn my camera off because I've got a face made for radio, so you don't have to look at me. Okay. But I would love to be able to entertain any questions that you may have.
Uh, Dr. Jones, thank you so much. I always like to give a special award to those of you really smart people that are able to explain things in the way that those of us that went to public school can understand. So I absolutely appreciate the clarity of your presentation and the usefulness of the information that you've shared. I don't see any questions in the chat, so I'm going to ask my colleague, Dr. Hines, to your fellow family practitioner,
Oh,
Dr.
Dr. Hines. Hoo, hoo, hoo.
Yay! Yep.
Where are you located? Where are you located, Doc?
I'm in Maryland. Yep.
Okay.
hmm
And
Well,
and former, if I remember
Yep.
correctly, former head of the Maryland
Maryland
Family
chapter.
Practice
Yep. I'm a past
Association.
president of the Maryland chapter.
no wonder you look familiar. I've met you.
Yep. I think so. Yeah.
But today's world, you can't say that to a pretty woman anymore because it'll be misconstrued. I'm just living in reality here, so I apologize,
No,
okay?
no, no. When you said that, I was like, wait, okay. Yeah, I'm sure we've seen each other multiple times at conferences and the like. Yes. But again, thank you for again, as Dr. Walk said, being so clear. One of the things that you kind of touched on was about the HPV
Yes.
vaccination. And can you speak a little bit about some of the pushback that you hear related to getting the adolescents in particular vaccinated with the HPV vaccination? Because I still see a lot of that now. Even they've got commercials and all that stuff, but there's still concerns.
I got to tell you a quick story. This past weekend, while we were at the NMA, we had a round table on immunization, specifically around influenza. And we also had present in addition to some of the officers of the AAFP and of the NMA, we had the president-elect of the World Organization of Family Doctors there. Oh, she's a faculty member at Duke. And she told us an interesting story. She said, you know, we got a very high rate of vaccines among Latinos for COVID, and we're doing it really good for immunizations, for influenza and others. And she said one of the reasons is none of the politicians that are putting out the negative stories speak English. I mean, excuse me, speak Spanish. So you and I have to compete with the negative stories about every single vaccine that we recommend. And so the negative stories such as if you get an HPV vaccine, then you're going to grow a third eye. You know, kids believe that stuff. And then their parents will say, well, wait a minute, am I giving them a license to go out and have sex early? Well, no, you're not. What you're saying is that if they engage in sex either voluntarily or involuntarily, voluntarily as the result of violence, I can at least protect you from hopefully protect you from developing cancer. And some people say, well, it's just a woman. No, it's the men now too. We now have the research to show that among the cancers associated with HPV, that they are manifesting themselves in men as well as in women. So the one thing that I would ask to do is to talk to parents. Now, here's the difficult thing for us, Dr. Hines. Once kids reach a certain point, the parents aren't really allowed to be in the room. It's called the age of reason. Sometimes I think the age of reason for my own children and those I've taken care of is 35. But once they get to that point of being beyond 13 or 14, in most states that's considered legal for them to be able to see the doctor on their own, make decisions and so forth. You and I know that that's the transitional phase in their lives, but some people view that as the accomplishment of adulthood. But the hard thing is adolescents think concretely, and you can't really discuss it with their parents without their permission. Here's an example about what I mean by concretely in their thinking. When I did my fellowship in San Diego, I went in to interview one of my young patients, and I asked, are you sexually active? And she looked at me and she said, no, how can I be? I'm sitting here talking to you. In other words, her sexually active
Not right
was right
now, right?
at that moment. That's the way they think. Okay. So being able to get the message across to them through trusted resources and ask their permission to be able to discuss some things with their parents. And then with the parents, you have to say, I am not giving your child permission to go out and have sex. With each of my three daughters, I had that discussion. I said, I'm not telling you to go out and have sex, but I delivered babies for people who did not have sex voluntarily. Okay. And I've also delivered babies for young people who really did not want to have sex in a relationship, but they did not want to lose that special guy. So what we want to do is to protect you from those circumstances, and getting this vaccine will go a long way. Now, the other thing that you got to remember is you're not going to go out in a hurricane without a raincoat and an umbrella. So if you go into sex, don't go without your raincoat. Leave the umbrella at home. Engage in prevention as well to make sure that you can at least stop the transmission of some things and also help to prevent unplanned pregnancy. I hope that answers your question somewhat.
It does. Yep. And great talking points for our audience out there too, who may be dealing with these things with their kids or with their loved ones and their families. So thank you.
Thank you.
And I'll follow up, Dr. Jones. Again, great talking points. I think that it's important for us to initiate those conversations. If we and this is a little bit tougher, but when we are the doc and we are the primary care person, maybe reaching out, maybe initiating the next visit. I've talked to a lot of people. Like you, I'm a veteran. I wasn't good enough for the Navy. I spent time in the Air Force. Um, but once you get out of some sort of a structured healthcare construct, you're on your own. And
Yes.
and like you said, 35 is probably maybe a little bit young for some of us to feel like we are able to manage our own things. So being proactive and talking with folks, I think, is again a very important part of your message. I wanted to look at one comment you made earlier, Dr. Jones, was about talking with your doctor or pharmacist. And I think a lot of times we miss that. Luckily, we have our resident Black Health Trust pharmacist, Dr. Gibson, who has put some good sites in the chat for folks to look at, for folks to go to, which are in addition to your recommendation that we go to the USPSTF site and make sure that we understand what's out there for us. But one of the things that maybe links your comments and Dr. Hines's questions, and where you started with the Tuskegee experiment, is just the mental health component of
Yes.
this and helping folks to, as I like to say, normalize these kinds of conversations. How can we get our communities to be more in line with just having this conversation, having these conversations, and allowing people to be more open to saying, wait a minute, I'm a little worried that if I get this HPV vaccine to my kid, that it's going to make them go out there and do something. So talk to us a little bit about the mental health aspect of this from a community perspective.
You know,
Before you answer that question, can I just piggyback on that and add the to that same question around the stress of, understanding changing recommendations, right? The changing recommendations on vaccinations also kind of contribute to some of that trepidation.
well, I want to say to both of you, thank you for the excellent primary and piggyback questions. Um, one of the things about the changing information in science, and this was a message I had during COVID, because I did a lot of presentations here in Mississippi, and they always partnered me with a politician. And I always told them I don't talk politics, I talk policy. Okay.
Mhm.
But my suggestion to you would be, if you ever get in that situation, let them know that. But what it is this. They didn't understand that the purpose of science is to grow new knowledge,
Mm.
then validate that knowledge, and then disseminate it once validated. So if we are telling the same message that we said 8 years ago, then time has passed us by. So
Mm.
we have an obligation as physicians to stay as current as we can be, which is why we call it the practice of medicine. We find the existing science, we look at it through the lens of our patients, and we try the interventions. And if we find something that doesn't work, we inform the literature, which then improves the generation of knowledge. The problem with the behavioral aspect of what's going on is there's something called community level and family level stress.
Mm.
And studies have occurred that show the impact of stress on susceptibility to disease,
Mm.
even whether they're transmissible or not, the impact of disease, and the likelihood of survival. I had the while back. I had the pleasure, the honor a while back, and hi, Dr. Lawson, it's great to see you, to chair the National Advisory Committee on Minority Health as the NIH, at the NIH under Dr. John Ruffin, a real pioneer in
Mhm.
health disparities. And one of the things that came out at that time was that there were studies being done on the impact of stress. And it showed that your likelihood of surviving a simple illness with stress in a shorter period of time was not very high, excuse me, compared to someone who had less stress in their lives. And what are the stresses we're talking about? We're talking about the stresses like the social economic determinants of health,
Mhm.
where you live, where your parents or you work, your access to healthful foods, your access to safe places to exercise. You know, I think about my good friend Dave Satcher when he was Surgeon General. He used to walk around giving us the Surgeon General's prescription for exercise. And when he spoke to us at the NMA in Hawaii, Dr. Hines, you may have been there, and he was giving us these prescriptions. And one of the family docs came up and said, uh, here's the thing, Dr. Satcher, I don't have a safe place in my community where I can exercise. What's one of the best ways of decreasing the impact of stress? Being physically active in exercise. So here we are. We don't have the right kind of access to foods. We don't have always access to a clinician. We don't always have access to appointments with that clinician when we can get it. And then we don't have the way to engage in healthfulness for ourselves. Now, one of the things I've learned in looking at my patients over the almost 50 years I've been doing this is that when people are so stressed out, they walk around in an envelope of fear all the time.
Mhm.
And that fear serves as a boundary to what they hear when messages are sent to them. And you may offer them meaningful ways of dealing with the challenges in their lives. But how do you get beyond the buffer of fear? That's in stress. That's why I talk about patient-centered and family-centered as being two of the key components of healthful life. Because most people have an Aunt Sally or an Aunt Minnie that they go home and talk about what happened at the doctor's office. So if you can make sure that Aunt Minnie or Aunt Sally has an idea of what went on and what the opportunities are to get better, they can help. I lived in New Orleans for many years. That's my hometown. And I remember in the 60s and 70s, it had a state of the art ambulatory care system for mental health. And now there's no mental health uh, um, service level readily available in New Orleans. Why? Because individuals made a profit out of mental health as others, and they moved it out of the city into the suburbs. And many of our patients depend upon public transportation, and where these go, these are not there. So I see some solutions for us. Let's leverage the positive forces in our community. Let's level the forces where people pray. Let's level the sources where people play. And let's level the sources where people earn their pay. And use that envelope as a way to involve them and surround them with opportunities for success. And call on the Elks, and call on the Masons, and call on the Divine Nine, and tell them, help us to make our community healthier and stronger. And to me, that's the solution. I remember when I was young, I did my first interview with a private doctor when I was going to college because all of my care was at Charity Hospital because that's all I could get. And they asked me, do you have hypertension? And I said, yes. They said, you have high blood pressure? I said, no, I'm always tense because sometimes we don't know the language. So we got to get together where we can make sure that we give our folks the language so that when they go to see their doctor or their nurse practitioner or their other primary care source, or talk to their doctors, Dr. Gibson, in the pharmacy, that they can understand what you're saying and you can say that. Last thing I'll share with you on that, and it's about the stress. It's about the need to understand how to communicate with our patients. My mother-in-law complained when I lived in Maryland about a misery she had in her side. And because I lived away, I couldn't really get her the resources. So when I moved to Mississippi, I brought her in to see a doc that I knew would listen to her. And that misery in her side ended up being, after a CT the next day, being taken to surgery 2 days later to remove a fungating mass off of her kidney. Because her doctors did not understand and could not really get to what that misery in the side could be. Our patients are not going to talk to us like a textbook. So we got to meet them where they are and help them to be sure to help us to help them. Okay. I hope that addresses the questions you have. Yeah.
Uh, Dr. Jones, that addresses the questions we asked and the questions we should have asked. So, so thank you so much. Dr. Lawson has his hand raised and would like to make a comment or ask a question. Please, if we can unmute Dr. Lawson.
Yeah, one of the paradoxes to me is I've always found it was very difficult to get folks to stop using IV drugs.
Mm-hmm.
And yet here's a situation in which they will not take vaccines.
Yes.
So trying to work through that and do, why is that? And I think part of it has to do with what is authority and who should you listen to. And unfortunately, we're entering into a time in which medical authority and factual information is being de-emphasized in the role of community folks that you feel comfortable with, even if what they're proposing to you is life-threatening. Just wanted you to comment on that.
Well, Dr. Lawson, you know, when I was talking about behavioral health, I covered this eye so you wouldn't see me because you've forgotten more about behavioral health and mental health than I'll ever learn. So thank you for all you've done in our field and the true trailblazer you are. You know, the way that I go about viewing the conundrum you describe is understanding the focus of the pleasure principle. When you stick your arm to use drugs, there's a pleasure derived from that. And you don't get that derived pleasure when you get a vaccine. And so we've got to have folks to seek the quick pleasure in anything we do and look at things in the long run. I don't mean to be super political, but one of the reasons we're in the political decision we're in is because our policymakers have been short-sighted, whereas the people who have want policies against us have been playing the long game. So what we've got to do is get a uniform set of messages out to our community that we have to stop looking for the bunt and we have to take the walk and we have to take the single. And if the home run comes, knock it off the fence. But if you're on base, you have a chance to score. Using that analogy, if we can get messages out, we have a lot of folks in our community who have beat the impossible burden of drug abuse and dependency. And if they can come back and share their stories, it may not be everyone able to follow that path, but it can say to someone that there is a path for you. And it goes to building that trust that you know we have to have, Dr. Lawson. My daughter finished the high school here, and my youngest in Mississippi, and it says their school motto was, "We will find a way or we will make one." So what I want us to do as healthcare providers, as we look at the challenges in our communities, say we're going to find a way within our community, or we're going to be the nidus of creating one. I found that our young people are so imaginative and creative. If you don't think that they are, look at TikTok, okay? Look at what they do. Look, I've seen that dance so many different times where people do, they've shown their creativity. So how do we get them to target that towards healthful outcomes? And that's where it takes multi-generationally sensitive, compassionate, and motivated individuals. I don't want to say to a young person, you don't understand what I'm saying. I want to say to a young person, I don't understand how to say it to you. So help me to figure out how to do that. Okay. The minute that we do that, we say to them, we don't know everything. Let's learn this together. When I was in the Navy, we first started using EHRs, and most of my colleagues had the computer turned away. I turned my computer screen where my patients could see what I was typing. Okay. Why? Because I could look at them and type, and they felt included. So I had a partnership with them rather than them walking away saying, my doctor told me to do this. A partnership, this is how we're going to help you to live better. Now, I think one last thing on the point you raised, Dr. Lawson, is simply this. We got to find and identify those who prey on our communities, P-R-E-Y, and work with those of us who P-R-A-Y, that we get them out of our communities and get them brought before the law and make them get away, because people are making money off of our suffering. Okay, families that are suffering are not making the money. The money that's being trafficked from people who are making a killing. And when I go to visit New Orleans and I go to the casino, when I go once or twice every 3 years, um, I'll sit next to someone who pulls out a wad of $100 bills. And I know he's not an engineer, okay, or an architecture or an astronaut. He's probably someone moving dime bags and stuff on the street. So there's a profit there. But guess what? He's not making the big money.
Mhm.
Big money don't come sit in a casino. They're flown internationally to casinos. So how do we get rid of this industrial complex that is keeping us subjected to disorienting drugs? It's not just the IV drugs. It's the dependency on pain medications. Okay. It's the dependency. Now we've got something else. We're all becoming dependent on GLP-1s because we all want instant weight loss and not learning how to curb our appetite. I tell people the best way to lose weight is to sit at the dinner table, and when they offer you a second or a third, put your left hand on one leg, the right hand on the other leg, lean forward, and giantly and actively shake your head, say no, thank you. Better than GLP-1s and anything else. We've got to learn that control. Okay. And when we do that, we learn that the vestige of control in our communities rests within us. And I pray that we do that before my lifetime comes to an end.
Uh, Dr. Jones, I don't know what to say, man. I can, one of the things that I pray about is the blessing of continued relevance, continuing to be relevant over time. And I look with admiration at people who can find a way to do that and who can grow and change over time. One of the folks that I was impressed with over the last couple of weeks who can do that. And I'm not sure if he's a good example or not, but I watch Snoop Dogg and I look at Snoop being able to be absolutely relevant dozens of years ago and still continue to be relevant now, and to be able to connect with people and carry a message and promote messages and influence folks. And I think it's a reasonable thing for us to strive for, to not just be, I've known Dr. Lawson a long time as well. And though he could rest on his laurels, he keeps continuing to pile on the laurels. It's going to be hard for you to climb up to get in that bed one day, Dr. Lawson. It's just getting too high. but
Well,
but I think being able to continue to push science forward, being able to continue to strive for relevance is something that enough of us don't do. So I really, really appreciate that.
may I
I
make a quick
don't,
comment about Dog? About
I'm
Snoop
sorry.
Dogg? May I make a quick comment about Snoop Dogg?
Absolutely.
He is the epitome of one of the things that I've always told medical students and residents: commit yourself to lifelong learning.
Hmm.
His lifelong learning was, how do I stay relevant and how do I make money? Okay. And he learned and he evolved on the basis of that learning. He
Yeah.
went from rolling down the street, smoking Wendy's, drinking my gin and juice, to now being told by the Queen, recently being told by the Queen of England that you can stay, and being featured the primary person at the Olympics, seen all across America. What he's done is he's learned that even though he was seen as the bane of society at some point, he continued to find ways to change himself in the eyes of those around him. And
Right.
that's why I'm saying to those of us who don't eat well, who drink too much, who smoke too much, who haven't learned to address those things that are challenges, if we invest in ourselves
Hmm.
and how we can get to be the best of ourselves that we can be, there's a pot of gold at the rainbow, at the end of the rainbow. It may not be money. It just may be 5 extra layers of life. You remember the ABC had a slogan that said, children should know their grandparents?
Mm,
Far too often, our children are dying young. My daughter died at 47 years of age
mm.
of congestive heart failure.
Wow.
I
Wow.
told her, I saw her and she had a vest on that her doctor was testing her, whether she needed a pacer defibrillator. And I said, you need a pacer defibrillator. Okay. She came to visit me in New Orleans. I said, go back and tell your doctor. She went back and told him, and he said, no, I want to manage you medically.
Mm,
I didn't find this out until later. Okay. 3 weeks later, she was dead.
mm,
Sometimes people who are not a part of our community try to generalize across our community what they think their institutional knowledge is. Now, when I
mhm,
talked to my friends at the ABC, they said if she had come to us and had shared what she shared with you, she would have gotten her pacer defibrillator. So, what it is, I know I'm preaching to the choir, but we need more choirs, more preachers, singing a lot more songs. It's the
mm.
way that we keep young people healthy. I have a goddaughter who had a major stroke at 41 years of age, working on the staff at the university where I was a trustee. She's still here today, but she's doing everything she can to get the message out. Folks, we don't have to have catastrophes in our families to know that there's a right way and a healthy way to do this. And my hope is that as a result of this, folks will live up to the name of your organization. For Black health, there will be trust
Mhm.
in the people that we turn to for healthcare and for advice. And we won't listen to the naysayers out there, that we'll follow the guidance of the people we love and that we know love us. Okay. I've been honored to be here with you today.
Dr. Dr. Jones, we have been honored and dare I say blessed by your presence here today. Um, as we are approaching the top of the hour, if there are any additional final comments you want to make, I think you just dropped the mic on that last one. So so
I agree.
so I'll go to Dr. Hines for any final comments that she has.
Yeah, I think Dr. Jones, you summed it up all in better than anything else I can think of to add, because there were so many major points there, right? Not waiting for the bad stuff to happen and then say, oh, well, let me do this now, right? The value in prevention, the places where, we have to advocate, where we're not necessarily listening to the right voices all over the place. There's so many points that you made. So thank you for your time today, and thank you for joining us, and thank you for continuing to do the work that you do.
Thank you so much.
So now that you family practice people have finished with your, just patting each other on the back, let,
We
let me
always have
just,
a love fest, okay?
right, right.
That's why our conferences are so much fun, right? Because
You know what? Let me say on behalf of the psychiatrists, myself and Dr. Lawson, it is really important that we reach across our entire community for inspiration. You mentioned uh, preaching to the choir, and sometimes, as the son of a preacher, I can say that sometimes the choir needs to be preached to, not because they don't know the information, but because they can be inspired to take the information out of the church.
Yes.
So I'm excited that you were able to positively take the Snoop Dogg in our community and leverage all of that useful learning and useful example and bring it to a place where people don't often think that there is an opportunity for connectedness. We have such an amazingly diverse community, and I think that sometimes we limit where we can find examples and where we can find connections. So I don't even know how to get on TikTok, but I might have to call you and you can tell me how to access TikTok. So with that, let me just say on behalf of Dr. Neighbor Stevens, on behalf of the amazing Dr. Randall Maxey, just thank you, Dr. Jones, for the time that you spent with us today. And as Dr. Hines said, thank you so much for all that you do and all that you continue to do. And thank you for the personalness that you've brought in sharing stories about your family and giving us your own history and integrating it into the message today. It's important that we can continue to be as augustly recognized as folks like you and Dr. Lawson, but still be able to talk to the regular folks and let us in about the fact that you are a regular human being. So, and I don't know if Dr. Hines would agree with this, but I think you might be the youngest 76-year-old I've ever met. So, so, so,
Well,
so with that,
I've got a 22-year-old daughter I got to take care of.
okay. Doc, on behalf of, first of all, let me thank Dr. Gibson for all of the information
Yes.
that he has put into the. Dr. Gibson, you put something into the chat, and I can't do two things at once because I'm not as young as Dr. Jones. Um, did you want to make a comment? I don't see a hand up.
Yes.
Oh, Dr.
Actually,
Gibson, go ahead, please.
yes, actually, thank you. I am really very, very grateful to you, Dr. Walks, for allowing me to thank our and you stole my thunder, August presenter for his incredible and incredibly useful presentation. What I have to say is that there is an event, very important event coming up in Los Angeles very, very soon on prostate cancer. This is
Mm,
something that comes home to roost in the Black community in an incredibly serious and deleterious fashion. So if we can just click on that one and actually, believe it or not, Dr. Walks, if you click on those and then click back on the Zoom icon at the bottom of your screen, you can get back to the session while on the fly. It works out very well. But my point is about the prostate cancer. We really, really have to say it often, and when we do say it, as you intimated earlier, we have to make it plain. Make it plain so folks can really understand that this is something. It's so horrible, this prostate cancer thing, because it can tend to metastasize, and before you know it, it's done a whole lot more damage than it would have had we had the protection that maybe, for instance, youngsters could get if they get the human papilloma vaccination.
Exactly.
So when we talk to folks about these things, they don't always understand it, probably because not all of us have the gift that you have for using language in such a beautiful way that you can metaphorically present information in a way that makes it plain and understandably very, very easily understood. So thank you so much for what you do.
So,
Dr. Gibson,
Dr.
you're so kind.
Dr. Gibson, eloquent and appropriate as always. I would like to say that you mentioned prostate cancer, certainly an absolute scourge in our community. And I'm going to, on behalf of Dr. Maxey, because I know he would say this if he were here, I could spend the next hour listing all the topics we would love Dr. Jones to come back and talk to us about from his family practice background. So I'm going to ask Dr. Jones to please be kind when he gets a call back for another visit with us. And I again want to encourage folks to go to the archives. I know some of the folks watching us watch us on YouTube, but all of the Black Health Trust programs are available on archive for folks to go and look at. So on behalf of our Black Health Trust team, want to just thank everyone for being with us today. And Dr. Jones, in light of your comment earlier about the folks who can't speak Spanish, I'm going to say hasta la vista. because I want you to come back again real soon.
Gracias. You know, my friend Dr. Maxey, he's kind of like a pit bull. Once he determines he wants you to do something, he will not turn loose until you do it.
Yeah, Dr. Hines and I know about that.
But I'm honored to be here, and I'd love to talk with you about prostate cancer and the scourge and the impact it has at some point. And because I just finished advising my brother, who's a very well-educated man, on how to deal with his prostate cancer.
Mm,
And when I was at Hampton University, they have a special proton beam therapy center
mhm.
there that can help to treat prostate cancer in a way that shows better outcomes in Black people. And many of us don't even know that.
Yeah.
So someday when you guys are bored with nothing else to do, just let me know and I'll come back.
You got it. You got it. All right, Simon, thank you so much. Please go ahead and take us out. Have a good day, everyone.
Have a good day.